Hi, I'm Dr. David Ajibade, and thank you for taking the time to watch this video. Over the past 5 years, we have been working with children with sickle cell disease, and we found out that a lot of their problems, their medical issues, can really be mitigated and reduced. Everything from the crises to the bone pains to the fatigue to the anemia, if we give them certain nutrients. So we are about to start a research in Lagos. We've got 3 government hospitals that have given us full approval. We're going to start with vitamin D3. And why vitamin D3? We found out that vitamin D3 does a lot of things, including it addresses inflammation, free radical damage. It also significantly improves the immune system, especially in kids below the age of 10. And speaking of the immune system, we found out that that is a missing link. It's a missing key where these kids are concerned. Most of them, if not all of them, have diminished immune systems for several reasons, which I'm not going to go into here. But we found out that simply by improving their immune systems, now we started with more expensive nutraceuticals, but then we switched when we found out, well, we haven't really switched yet because we're still going to be working with the more expensive nutraceuticals, about $100 a bottle. But with vitamin D3, for like $8 a bottle, you can last for almost 2 years in some cases. So we found out that this is a much more sustainable model, and it can certainly help in many of the remote areas around Nigeria. So we're going to do a 6-month project, kids below the age of 12, from let's say 6 months to 12 years. And we're going to give them vitamin D3, and we're going to watch to see their improvements. Obviously, do the blood count and the other parameters. But the goal is this: to produce data that we can present to the federal government to say that we need to change the way we're treating these kids with sickle cell disease. As you probably know, 50 to 75% of the kids born with sickle cell disease will not live past their 5th birthday. That's a current statistic. Our goal is to reduce that to less than 10% by 2025, 3 years from now. And so there's a lot of work that needs to be done, but that can only be done if healthcare professionals, parents, teachers, doctors know about this approach, that they can give things like vitamin D3. We also found out about zinc and vitamin C they can all work in helping these kids with sickle cell disease. So I want to ask and appeal that you helped us in funding this. We've decided to go forward. We've gotten funding for at least the first 1 or 2 months. We need much more than that. So the budget is included in probably the link below, and more information about our research and what the work we'll be doing will also be included, along with several videos, testimonials from parents, video testimonials from parents showing that our approach really works. So this would help a lot of Nigerians, will save a lot of lives. We know that over 100,000 kids will die every year. 100,000 people in general will die, but most kids, like I said, before the age of 5, 50 to 75% of them will die, and that's about 100,000 as well. By the way, 100,000 is the number of kids that have sickle cell disease, number of adults and kids that have sickle cell disease in the United States alone. So we have that number dying every year. So I really think we can make a huge difference with this. So again, thank you for taking the time to watch this, and I hope that you will help to support us in this venture. Thanks, and God bless. Bye.